And when the new year starts, Anthem, Blue Cross, Blue Shield members can keep going to Ohio State University Wexner Medical Center. And that's the agreement they both came to just one day before the deadline. But patients on Anthem's Medicare plan are still not covered. 10 TV's Carly Dion is live tonight with more. Carly?
Yolanda, while some Anthem insurance holders are breathing a sigh of relief tonight, those under the Medicare coverage are disappointed that their plan was not included in this new agreement.
In this day and age, all it takes is one catastrophic illness without insurance to literally bankrupt you.
Especially for those who are on a fixed income, like Michael Gallagher and his wife, who were left scrambling when they first received notice Anthem Blue Cross and Blue Shield would no longer be accepted by their doctors at OSU Wexner Medical Center in mid-November, with an open enrollment deadline fast approaching. The second week of December, they received a notice from Anthem.
Their statement was, well, basically, we might come to agreement by the end of the year. It was like, well, but after December 7th, the deadline, the window closes to be able to find a new insurer.
And Gallagher was not willing to risk it. A friend put him in touch with a broker who specializes in Medicare.
It was very hard to get an appointment because they were swamped. Because not only was Anthem and Ohio State having an issue, there were two other insurers that were having issues in the area.
That broker helped him and his wife find a new insurance provider because they were not willing to give up the doctors they came to know and trust, especially for Gallagher's wife, who has some health conditions that require specialists.
Find a doctor you like. You don't want to lose them because two people can't come to an agreement.
With 1 day left until a number of Anthem insurance policyholders would no longer be covered at OSU, a deal was reached, excluding those on the Medicare Advantage plan. And if you hadn't found a different insurer through this process, how do you think you'd be feeling right now?
Scared, concerned, not knowing how much it was going to cost us out of pocket this next year.
Because Gallagher says as you get older, the more important it is to have any medical expenses covered.
You're retired and you've got a plan for future, expenses and so forth. The last thing you can afford is a huge medical bill that will take you years, decades maybe to pay off.
Medicare patients officially lose their coverage on Wednesday, but they'll have another opportunity to switch their insurance provider during an open enrollment period, which also begins on Wednesday. Live at Wexner Medical Center, Carly Dion, 10 TV News.